Hi everyone, it's Walt Fritz from Foundations and Manual Therapy Seminars with another bit of evidence for you, for the evidence for manual therapy for the speech pathologist and others. This paper isn't directly referencing manual therapy, but it's become a paper that I use to really ground my work, ground the approach that I take, and ground the concepts that I explain my work with. And today we're going to talk about a paper by speech pathologist PhD Leah Helou from the University of Pittsburgh. The title of the paper is Crafting the Dialogue, Metatherapy in Transgender Voice and Communication Training. And what Dr. Helou has done in this paper is to take a look at the concept of, I'm going to paraphrase quite a bit of it here, but in the way I view this paper, it's talking about why we get the effects that we get with our treatment. How much of it is attributable to the technique itself, and how much is the indirect meta that surrounds the therapy itself. Therapy being the technique, the meta is what surrounds it. It's what we've learned. It's what mentors have taught us. It's what experience was shown. Maybe even what the patient shares. The meta becomes almost as impactful and maybe even more impactful in some ways than the therapy, than the technique itself. These are concepts that Dr. Helou introduced to me during a Zoom talk I was giving to the University of Pittsburgh a couple years ago. And her and I then had a conversation about her work when you invoice when it comes to the metatherapy concepts in a couple of her papers and then a couple of papers that she's contributed to with others. But what really, started this conversation was how Dr. Helou, as I was giving my talk on manual therapy for voice to the University of Pittsburgh Grand Rounds, she recognized qualities of my approach in that it's not just the technique that we do for the pterygoid or the cheeks or whatever, in terms of what we're doing with our hands when it comes to manual therapy. But to me, what's equally, if not possibly more impactful, is this sense of community that I build surrounding that technique, the sense of communication and awareness building, using shared decision making. I'm building sort of a wall around the technique, that meta that surrounds the technique is the conversation that I have with my patient, that patient buy-in and building understanding of why what they have to say is so important. I think what's really key to this paper too is it doesn't just apply to voice. It doesn't just apply, certainly it's not written with other interventions in mind, but the concept of metatherapy is a real rich one for those of you working using, whether it's exercise-based work, manual therapy-based work, or any kind of works like that, to understand that there's so much more we are doing besides just our technique. And if we can pause for a bit and kind of just sort of look around the room at what it is we're presenting, how we're presenting this technique, the context, everything that underpins that work is part of the metatherapy. So as usual, you can find this paper on my website. If you need to be a newsletter subscriber to that. So go to the website waltfritz.com and find I joined the newsletter community or something like that. Link on my website. I'm not quite sure, but from there I will guide you on how to find and download this really fine paper for understanding truly how our work works.